Well, I'm Dr. Jim Del Rosso, the editor-in-chief of clinical dermatology of the Journal of Clinical and Aesthetic Dermatology, commonly referred to as JCAD. And here we are with JCAD Dialogues and Reviews, another episode, which myself being JDR, it's my responsibility also as the editor of the journal to bring important information to you. Some things that maybe you're not aware of or you just haven't thought about because there's so much that comes across our desks and in front of our faces every day in our practices and in our life. So there's a lot of potential distractions. One that I think is really important is something that was actually first reported um, maybe about 7 6 7 years ago. I don't remember exactly when, but it's been a while that there was some reports of patients, and a lot of these patients were younger patients. They were younger adolescent patients, and even patients that could be later adolescents or older that were prescribed trimethoprim-sulfamethoxazole, oral antibiotic that's been out for a long time, used to treat a variety of different infections. We use it in dermatology as an off-label use for many patients that have acne, that tend to have more severe acne, refractory acne, as an alternative, and sometimes to treat certain cutaneous infections, especially gram-negative, when gram-negatives emerge. Or even if you think a patient on long-standing antibiotic therapy um, has gram-negative acne or gram-negative folliculitis, sometimes trimethoprim-sulfamethoxazole is prescribed as an oral antibiotic. So it's very important, first of all, to recognize the brand names that this is referred to. It's available generically, but brand names that this has been referred to is Septra or Septra DS double strength or Bactrim. Bactrim DS. The DS is the double strength. And so it might be written that way or generic of Septra, generic of Bactrim. They're talking about trimethoprim sulfamethoxazole. So very importantly, and this really is very significant, even though it's rare. When the patients are affected by it, the outcomes are disastrous in many cases. And I don't want to make it sound like it's worse than what it is. It is a horrible situation when it happens, and one that can happen very, very quickly. And that's acute respiratory distress. So you're talking about within a matter of days. And some of the examples were patients, they were teenagers that were given trimethoprim-sulfamethoxazole orally for acne. And then within a matter of days, certainly within a couple of weeks, they develop very severe respiratory distress. They can't breathe. They go to the emergency room. They're often put on ventilators for supportive care. Some have needed lung transplants, and some actually die. So we're not talking about a smoldering type of adverse event that tends to happen over time, but something that can happen very acutely. They've been relatively rare cases, but we continue to see more being reported. And there actually has been a change by the Food and Drug Administration to the approved labeling of trimethoprim sulfamethoxazole to recognize that this is a warning. Now, we know that trimethoprim sulfamethoxazole, we often will sometimes refer to it as TMP sulfa, has some very, very severe potential adverse events. Most common ones we know about, and we see cases of it. We know that sulfonamides, which sulfamethoxazole is a sulfonamide, are the most common causes of toxic epidermal necrolysis, or TEN. And once again, these are relatively uncommon, but they happen enough that you have to think about that when you're prescribing um, a TMP sulfa, trimethoprim sulfamethoxazole. It's probably the most common cause of toxic epidermal necrolysis, where patients slough skin, they become diffusely like a burn patient, and they have significant morbidity and sometimes mortality. And that will usually happen relatively early on. usually within the first few weeks, month of utilizing the drug, maybe into the second month. So it happens early. We know about it. It's in the back of our minds. Patients develop painful skin and they get this diffuse sloughing. It's a different entity than this acute respiratory failure, but it's important to recognize that's also another possibility. There can also be changes in blood counts, and these can happen later over time. Red blood cells, white blood cells, platelets, rare cases of agranulocytosis, which can happen after patients are on the drug chronically. And I know Warren Piet, who is an incredible skin ternist, a dermatologist that does a lot with treating a lot of major internal medical problems, like patients that have severe adverse events. He sees a lot of them. He gave me a tip. If a patient that's on TMP sulfa or a patient tells you they're having the worst sore throat they've ever had in their life, light should go off and think about agranulocytosis. I never forgot that. It's rare, so hopefully and likely you're not going to see that in your in in your career. But just remembering that this drug, sometimes given out in a very cavalier fashion, oh, I'm going to give this to somebody with acne. Maybe not a lot of discussion on what the adverse events are because they are uncommon. And then occasionally there are these patients that I'm talking about that have these problems. So the acute respiratory distress is very quick, very severe. There's research being done on it. There's a group of dermatologists and other researchers trying to identify biomarkers that can predict the patients that are going to get this reaction. It's in early evolution. There are some genetic markers that are being worked on. But right now, the bottom line is if you're putting a patient on trimethoprim-sulfamethoxazole, in the back of your mind, although rare, you never know who is going to be the patient that's going to have one of these very severe problems. So there needs to be some type of education to make sure that people know that there are some rare events that could happen on the skin or maybe some changes that are happening with the breathing. Immediately they need to be looked at to make sure they're not developing one of these adverse events. So I think that's not to scare you, but that's to put you in the mindset of reality because rare situations rarely happen, but they do happen to people. And any one of those people could be someone that was in your office. So that's very, very important.